This presentation will focus on intersectionalities within the opioid crisis. The reason I am addressing intersectionalities within the opioid crisis is because it is important to not only examine the issue as a whole, but to analyze the inequalities within the epidemic. Opioid use needs to be addressed in general. However, it is important to consider who the crisis has the greatest impact on and the unique obstacles and circumstances historically oppressed groups must face in addition to those faced by the general population. Societal issues cannot be addressed as one united problem. The intersectionality of many factors must be taken into account because individuals are affected in different ways based on these factors. In this case, we will look at how gender, race, and socioeconomic status create additional challenges within the opioid crisis. Women are affected by the opioid crisis due to both biological and socially defined roles. The use of opioids has unique effects on female hormones, consequently creating unique and additional effects on fertility, pregnancy, breastfeeding, as well as menopause. There is also an increase in opioid use for women based on their feelings of need for weight loss, self-medicating for mental health and pain, as well as for exhaustion. The effect of opioid use for women differs from men, and that addiction may occur earlier in use. They may be more sensitive due to certain hormones, have greater amounts of cravings, as well as more likely to relapse after treatment. We can see from focusing on the main difference in this chart that women in the study show greater levels of pain withdrawal symptoms and opiate cravings. Principal change in composition and physical effects are greater on the hearts and blood vessels of women using opioids. Use also leads to greater rates of depression and anxiety. Other factors that must be taken into consideration are domestic abuse, which leads to greater chance of opioid use, as well as familial events such as divorce, custody over children, or a family death. Throughout the time studies have been done on the topics of opioid use and addiction, women have often been excluded. This is because they have been labeled too complicated or complex, as well as too busy. Women also choose not to seek treatment as it will lead to legal repercussions if they are pregnant or have children. The image shows the care mothers should receive when pregnant after having given birth, when also using opioids, or have an infant suffering from NAS. However, this is often not the case as there are many stigmas around opioid use in women, in this case mothers, which often leads to legal repercussions previously mentioned. The death of a white actor due to opioid use led to a new portrayal of addiction in the media. They crystallized opioid deaths, leading the population to believe anyone can be an addict. Newspapers began using pictures such as the one shown to portray this, and led the population to believe that people with this addiction are simply blameless victims of their biology. However, that is not the case in general, as the loaded language portrayed in the media clearly divides racial minorities when discussing addiction. This language includes the use of words such as suburban and urban to differentiate races. They also began using physical descriptors and names to create a divide between races. The media's portrayal of addiction was meant to support and decriminalize whiteness, while simultaneously criminalizing Blackness and posing these minorities as threats to society. Non-white minorities receive discrimination in healthcare and in opioid treatment. Demographics of a patient can be the determining factor for the provider, often resulting in a lack of care for minorities. Many studies, pseudoscientific studies, have been conducted stating a biological difference between races, placing them in different categories and affecting the prescribing methods of physicians. This chart shows the different levels of care patients are receiving based off of their race. When it comes to non-white minorities receiving treatment, it is often seen as a moral failing to have an addiction rather than an illness. This leads to less care and higher rates of incarceration. The source of treatment also varies, as less access is granted to minorities, and when treatment is provided, it is more likely to be through a primary care physician rather than an addiction specialist. Socioeconomic status is another major issue to focus on within the opioid crisis. Those with low incomes are generally in environments with less education, poor social and environmental conditions, and face social exclusion as well. All of these lead to an increase in opioid use and account for changes in brain composition and economic stress. These conditions and stressors lead to drug cravings, self-administration, and high rates of addiction. Additionally, These unenriched environments lead to greater rewarding effects with drug use, leading to a continuous cycle of opioid use. This map depicts areas within the country suffering from the opioid crisis, as well as those in poverty-stricken communities, and how these two factors intersect. It is important to consider how the cycle of opioid use in poor communities is affected by the healthcare system. Rural and economically disadvantaged communities have little to no access to healthcare. It can be absent altogether or unaffordable if present. Overall, evidence-based treatment for opioid addiction is not available. However, cheap and accessible drugs, such as heroin and fentanyl, are becoming more common in use within these areas. Another factor leading to opioid addiction in poor communities is the use of Medicaid. Medicaid is used for low-income individuals, and studies have shown that those receiving prescriptions with the use of Medicaid are receiving longer prescriptions and higher doses. Because this insurance is so commonly used in economically disadvantaged communities, it allows the cycle to continue. Each of these intersectionalities within the opioid crisis are important to consider. It must be acknowledged that these factors also function outside of this epidemic, affecting all social issues. Similarly, many individuals are impacted by more than one of these factors, and both must be taken into account both outside of and within the opioid crisis. For example, a female who is also in the lower class, or a female who is a racial minority, and so on, can also be affected by opioid use. There are many intersectionalities that could be considered within the opioid crisis, and these three, race, gender, and socioeconomic status, provide some insight into how certain populations are at greater risk for inequalities within the crisis. These issues are relevant within society, and the opioid crisis is as relevant as ever. Evaluating the intersectionality of these factors and social issues allows us to address inequalities and the changes that need to be made surrounding the opioid crisis.